Hello there, good morning, good afternoon, good night, or whatever time it is as you listen to this, the first in a new podcast series called Diagnosing Ireland, where we talk to Irish and international experts about healthcare here in Ireland, looking at what we as a country get right, what we get wrong, what could change for the better, and what we can do about it. So we'll be covering lots of different aspects of care, from mental health services to nursing homes to the use of health tech across the sector and the ways it affects and serves the needs of you and I, the population. But given that we're almost a year into a global pandemic, we couldn't really start anywhere but with the elephant in the room, could we?
We've not witnessed a pandemic of this nature in living memory, and this is uncharted territory for us. We said we would take the right actions at the right time, and we have to move now to have the greatest impact. So from 6 p.m. today, the following measures are being put in place, and they will stay in place until the 29th of March.
Hard to believe that's almost a year ago. The Taoiseach there, then Taoiseach Leo Varadkar, last March, announcing the first COVID-19 lockdown, but not the last. Little did we know then what was to come. Well, today we're kicking off Diagnosing Ireland by looking at COVID-19, Ireland's response, international best practice, and much more besides. We're not going to get into things like the EU versus AstraZeneca, who should get the vaccines first, or anything you're hearing about daily on traditional news programmes. This is a look right under the hood of Irish healthcare at how things are done and why. Well, I know all about Ireland's response to COVID-19, you might say. I've been living it locked down for months, and that's fair enough. So let's look elsewhere to start and offset our own COVID fatigue with Finland's. Joining me is Mika Salminen, Director of Health Security at the National Institute for Health and Welfare of Finland. Mika, thanks for being with us. I wouldn't go as far as to say Finland is Europe's gold standard when it comes to COVID-19, as there isn't really any such thing amidst a pandemic such as this. But it is fair to say that comparatively speaking, you guys are not doing half bad at all. You've 90% fewer cases than Sweden, 33% less than Norway, and 78% fewer than Denmark. So what did Finland do differently?
So I think the main issue is correct timing. We had the fortunate situation that, for example, compared to Sweden and Denmark, our epidemic actually started about a week or two later. And we could see what was happening in the other countries. What we did very much differently is that we have a preparedness law, which allows the government to get special powers in a crisis situation. And originally that was built for military and natural disasters. But in 2014, we added the pandemic as a scenario. So that's what happened when the government realized that we are in deep trouble. We actually, by a joint decision of the president and the cabinet, put in place the special circumstances, which gave the government more powers than usually.
Okay, so timing and the law of preparedness were crucial, but what about your overall strategy beyond that? I know while some countries chose suppression or elimination, it does seem like Finland went for something very close to zero COVID, even if that's not what you were calling it.
Well, I mean, everybody knows that elimination is not possible. This virus is here for forever in the world. What we can do is to suppress it as much as possible. And basically, we did the same things as all the other countries, except we never had actually a complete lockdown. We never had all the stores closed. We never had a curfew. But instead, we put in place enough measures to reduce the contacts between people, so that we actually had a reduction of about 90% of the contacts of people in the spring. And also it was very easy for Finnish labor in a very large degree to go for distance working. So we have about 60% of the people distance working even today.
In terms of how that was achieved without a full lockdown, in Ireland, we've been in and out of lockdowns since around this time last year. So it would be interesting to hear what you're doing that we're not.
Right. Well, again, this is much about timing. So we actually put in place the measures very early. which meant that they probably were more efficient. We put all the government workers on distance work. We did close the schools in the spring for about 2.5 months, and we highly discouraged any travel abroad. And that's actually also an important point, because we never sort of reintroduced the virus during the summer, which happened in many other countries actually. It was very minor in Finland. And because we never had the virus sort of widely spread in the beginning, we were able to suppress it for the summer for a very long period, several months actually, before we started getting some increase in the fall. And I think that was quite crucial. The other thing is that Finland is fairly sparsely populated. We don't have very many large metropolitan areas. And maybe there's something with the Finnish mentality also. We are maybe not as, let's put it this way, our personal space is closer to the 1.5 meters than maybe in some other countries. So this may have helped us too. There is no magical formula. I think it's a combination of many different things.
And what about other resources and other factors in the fight against the virus, other than the speed of action and the Finnish affinity for personal space? You had a heavy emphasis on track and trace,
Right.
didn't you? And medical teams meeting arrivals at the airport. You had sniffer dogs at the airport.
Yes.
Was this a case of more resources or better resource management?
I think we did spend a lot in ramping up the testing capacity and the testing and the tracing capacity as quickly as we possibly could. So we went from March, when we had maybe capacity to test 1,000 people per week, to the capacity that we have now, which is we can do about 30,000 every day if needed. And also it's free, and the threshold for indication of testing is extremely low. So if you have a headache, you can go to a test. If you have a muscle ache, you can go to the test, and so on. So it's really been very heavily communicated that any small symptom, you should go and test yourself. And these places are now everywhere. You can book it online, and you get. I did a test a couple of days ago, and I got the time for the testing 2 hours ahead. I could have gone earlier, but I just couldn't get there that quickly. So the testing is really important. And then we trained about 2,000 people for the tracing. And that's actually very crucial. I think it has kept our transmission chains on average short, and helped us a lot. And then the last thing is that we have in the infectious disease law the quarantine. And if you are put in quarantine, you get 100% compensation of your loss of pay from the social insurance. And that's, of course, important, because you don't have to think about, okay, I'm going to lose my income for this 2 weeks that I have to be in quarantine. So that has helped us quite a lot.
Well, it sounds like Finland is in pretty good shape right now, considering. But has it been smooth sailing, Mika, or have you had bumps on the road like the rest of us? In Ireland, for example, COVID in care homes has been a really big problem. We've had around 1,500 deaths here, one of the highest rates in the world. I think it accounts for almost 2/3 of all our COVID deaths.
Well, initially we had quite some deaths in the long-term care facilities and the elderly homes. We quite quickly realized that this is going to be a very risky place. So very early on, we instituted a complete visitation ban. So no visits allowed, which was quite harsh actually for a long time for the people living in these homes, but at that time deemed necessary. And we put in a lot of extra disease prevention measures. So we mandated use of mask of all staff. We put in extra testing of the staff in the long-term care facilities. And this has worked fairly well. It's not been 100%. We still have outbreaks now and then. But if we look at the incidence of disease in the very elderly, it is actually below average. So we managed to lower the impact in the elderly care homes.
Okay, and let me bring you back to something you mentioned earlier about full pay for everyone who's quarantining. That's a big spend.
Yeah.
But then I suppose your economy has taken less of a hit than others during this pandemic, hasn't it? We've seen an EU average of around 12% contraction, but Finland's is hovering at around 6%. So, how have you
Yeah.
come through a global pandemic with only half the damage of everyone else? Is it happier consumers, or maybe avoiding full lockdown protected consumer confidence?
Last week we put 14,000 people in quarantine, and that's the average number. It's so it's not cheap, but our economists, and we've been working across the fields here, explain that actually it's turned out, and there are studies on this already. It's turned out that it's economically much worse for a country to have a widespread, severe outbreak of infectious disease. People get scared, they don't spend, it affects their working ability, and all of that sums up to a much worse situation than when you actually do the measures in time and can prevent that. So that's the explanation that we have been giving. We were worried about this, of course, in the beginning that there's going to be a disaster for the economy, but it actually turns out that reacting early and putting in place the restriction measures is economically more beneficial than just letting it go. In the summer, we did open up quite a lot. Actually, there were very few restrictions left, some restrictions on mass gatherings, but crucially, a very strong recommendation not to travel abroad. And we also had very strict entrance requirements. So basically, travel basically stopped. Any non-essential travel stopped. Our airlines were not happy, but this actually helped us probably to get through the fall. There's been a lot of back and forth about the schools. Our experience so far is that the schools are not important for transmission in the very big sort of picture, unless the incidence goes very high up. So we've been able to keep the schools open. Universities are closed and distance learning. And we have closed the secondary level schools in many regions, but otherwise primary schools up to ninth grade are open. Daycare is open, and that doesn't seem to be a big problem. We have, of course, sometimes outbreaks, but those are aggressively contact traced, and that keeps the situation under control, at least so far.
Well, Mika, it seems from what you're saying, Finland made a lot of effective decisions, but ones that were likely unpopular at the time. So, is the Finnish government less concerned with re-election than other governments, or are they happier to make hard choices quicker and popularity be damned?
Yeah, I don't think any politician thinks quite like that. But certainly in the beginning, there was a wide consensus, not just with the government, but the opposition too, that things needed to be done, even if they were unprecedented and sounded really dramatic and impacting lots of people's lives. It seems like people appreciated that the government was careful and didn't take risks. I mean, that's how the interpretation has been. Also, they were quite successful in their communication to the people, so that people actually understood why this was necessary. Of course, the longer it takes, it becomes harder because there are some sectors or some people in some types of work that actually are suffering a lot. We have the performing artists, we have partially the sort of event business, sport, anything that requires lots of people to gather are of course suffering because that's completely impossible at the moment. Travel industry, although that's been partly compensated by Finns staying at home and just spending their holidays in Finland instead. But for example, we usually get huge numbers of tourists from the UK, I think from Ireland too, to Lapland in the winter. And this year that was totally absent, which is we are talking about 500 million of income for the region. And that, of course, was felt quite severely. But the majority, even in the opinion polls, have appreciated the careful approach of the government. That is quite clear. There is pandemic fatigue for sure. People are getting a bit worried and tired of all the restrictions, especially the young people. We can see that clearly. But so far, we have pretty much been able to manage that. I'm not saying that's going to work forever. The thing which is helping now is the vaccines are coming. So we are hoping that we could manage until summer, but of course we are not out of the woods by no means. We could have a backlash anytime. That's clear.
Well, you're certainly quite right about COVID fatigue, and that is being felt everywhere, there's no doubt. You mentioned there a summer timeline for reopening. Are you worried that when we reopen, there'll be a surge of cases then?
Yeah, so the plan that the government has is to keep things closed until we get enough people vaccinated. That's clear. We're not completely closed. I mean, bars and restaurants are open, but the opening hours are restricted. And also, they can only have half the tenancy rates. Regular shops are all open. There are no closed stores at the moment. The restrictions are more about the mass gatherings, and there the threshold is very low. So we only allow 10 people to gather at the moment. That means, of course, that many activities like theaters and movies are closed. Museums are closed, and so on. I think depending on how fast we can vaccinate the risk groups and the work age population, we may or may not see a big surge. I'm not thinking that none of the models show that the virus would go away. There will be cases after we open up, that's clear, but they will be hopefully at that time among younger people where the disease is not that severe.
Yes, young people being more social anyway, of course, but there may be young people listening to this here in Ireland who think that life in Finland already sounds like a bit of a utopia at the moment. You still have bars open with limited capacity, you retail stores open, and we have none of that right now. What we do have is a similar population to Finland, a similar rate of COVID app downloads, a similar budget spend in response to the pandemic. If I was a bored, confined teenager right now, I'd want to know what you did that we didn't, or what you're still doing that we're not doing.
If I would know that, I would probably be wiser about what we should do in the future. I think one of the things that we have done, we've had a regional approach from the beginning of the fall. We have 21 regions. Each of them have a coordination group of who decides on what to do. And we have very clear sort of triggers. If you go this incidence, if you go over this burden on the healthcare system, then the next phase kicks in and you will have to close up. And after some delay in the fall, when we were sort of learning the system, which is completely new and sort of invented on the fly because we didn't plan for that, they've been actually very active and fast. So, for example, last 2 weeks ago, we had a big outbreak among younger people in relation to a bar in the middle of the country in a smaller city, and 150 cases in just a week. And basically, they closed everything. So they went to the highest level of the stage. And this has happened several times in the fall. So regional closures have been able to stop the spread locally and go back to the sort of basic level. And that's also part of the speed. So we haven't done sort of everything the same in the whole country, but with the regional approach. And that has worked quite well so far.
Okay, so regional coordination, but what about nationally, Mika? Who's advising the Finnish government? In Ireland, for example, there's a lot of criticism in some parts among scientists that we're not taking enough advice from academics and that our advisors are mostly civil servants. So how does that work in Finland? Who's advising the national government?
So I think the government listens to many different sources. They have a scientific panel which is consisted of academics from different areas of life, not just medical expert, but social experts, economics, and so on. But the major advice on the actual responses in terms of disease control, that comes from the National Institute for Health and Welfare. That's basically where I work. Very early on, we were integrated in the government coordination group, and we have been sitting in all the government meetings since then, which are more than 100 now, I'm sure. This kind of cross-sector work is something which actually Finland has trained quite a lot on in the past. We complain about it all the time that it's not working perfectly, but actually we have been doing it for a long time, and it's formalized actually in the training of the top level government workers actually.
And how's the Finnish health system in general, Mika? It's pretty robust, right? So what about things like waiting lists and services that predate the pandemic?
Right.
In Ireland, we've some of the highest in Europe. We've 600,000 people on the waiting list here. So even before COVID, we had problems.
Right.
Did you?
So we had this problem about 10 years ago. And then the government put in a law that puts pressure on the actual providers. So there is a heavy fine if you go over a certain average waiting time for accessing care, and especially for the hospital care. So that has actually, and also it's a big embarrassment for the regions that run it. So that has actually allowed the hospitals to make the system more efficient, so that those waiting lists have shrunk quite quickly. Now they have grown again because of the pandemic. We had to shift resources to COVID care. So they grew in the spring quite a lot. But in the fall, what I know is that they were able to catch back on the waiting list. So they are not that bad at the moment.
And you're no doubt hoping to keep it that way. Okay, Mika, thanks so much for joining us. There is a lot of food for thought there, but let's wrap, if you don't mind, with a summary in 30 seconds or less. Can you tell us what Finland did right, what it did wrong in tackling COVID, and what could have been done differently?
The two smartest moves were we acted fast and sort of comprehensive enough. So not just one thing, but we did a lot of things at the same times to reduce the contacts between people. And the other one was that we didn't travel during the summer. That was really important, extremely important actually. People went to their summer cottages instead than going to Italy or France or Thailand or something like that. That basically stopped. Differently, the school closure in the spring was probably not that important and had a lot of negative effects on especially children who did not do so well in school anyway. It's socially extremely costly. So that is something which we are now considering it as the very last resort of actually doing.
Mika Salminen there from the National Institute of Health and Welfare of Finland. Well, you heard from him about how Finland is dealing with COVID-19, but let's look a little closer to home now at Ireland's response to the pandemic. I'm joined by Thomas Ryan, Associate Professor in the School of Biochemistry and Immunology at Trinity College, Dublin. Important to give your full title there, Thomas, but of course, to most people up and down the country at this point, you're probably better known simply as the Zero COVID guy. So let's start with the basics, shall we? I know you'd have to be living under a rock to have avoided extensive details of the ins and outs of COVID by now, but nevertheless, could you give us a very brief synopsis to kick us off? What is a simple explanation of the Zero COVID method, and why are you a fan?
Well, Zero COVID is, I suppose, a kind of a catch-all term that we've been using at the Independent Scientific Advocacy Group in Ireland to promote an elimination approach to SARS-CoV-2 in Ireland. So Zero COVID is international in its recognition. Some people use COVID Zero, but of course you'll find reference to that all over the world. It's not really a new idea in the sense that we've had elimination approaches to diseases for a long time. And so elimination technically just means the removal of a pathogen. Could be a virus like SARS-CoV-2, could be a bacterium like that which causes tuberculosis. And it means just removing it from community so that you can exist in a particular area of the world without significant risk of coming in contact.
Well, Tomas, this isn't a new idea, so why are we not doing it? The daily cases are twice as high as October, and the death rate is even higher than the first wave back last March.
Well, I think we should be doing it now. It would have been better to have been doing it back in March. I suppose we thought that we could manage it. So from the beginning of the pandemic, it was obvious that there were three broad options for Ireland. One is elimination, which we didn't do, obviously. The other is suppression, which is the idea that we could keep it at relatively low numbers with an excellent test and tracing capacity and just keep it from flaring up in the community, but basically go about more or less normal life until a vaccine created widespread immunity. And then the third option was mitigation, which was not a desirable strategy for anyone at the beginning, long term. It's what you do when you're in lockdown. So when you're in a lockdown, you know you're in a mitigation strategy. It basically means we open up, and then when the virus numbers get to a certain level, we close down. And we may have to live in rolling lockdowns or constant lockdown under that kind of a framework. So we knew we were in a mitigation strategy in March and April of we didn't have a choice. Most of Europe didn't have a choice. We just weren't prepared in the way that East Asian countries were prepared because of their experiences with SARS and MERS. Of course, even New Zealand started with a mitigation strategy because they had to. But then it was all about the exit strategy. Okay, once we get things under control, what are we going to do? Because if we persist with a mitigation strategy, we will have rolling lockdowns. The government in Ireland chose to adopt what they called a suppression strategy, which was the middle strategy, which failed. And we knew that it was failing from about August 2020 because we seeded the country, first of all, with lots of new variants of the virus that originated primarily from Spain. They greatly increased the virus numbers in the community. Since then, it was in exponential growth. I mean, really, it was in rock steady exponential growth since June, July. And in August, though this was not necessarily appreciated at the time, it's when it became clear that we weren't suppressing it. So we got to a case number that just kept rising, that was not being suppressed by our public health measures, partly because testing and tracing was wound down over the summer. And eventually by September, reached a case number that our public health teams couldn't be expected to manage. I mean, we only have about 65 public health physicians who are the ones who take care of outbreaks throughout the country. And it became too much for them to possibly suppress, even in theory, by September. And then we let things grow continuously until we had to have a second lockdown, which fortunately we had early enough not to cause too many deaths, but not early enough so as to be a short lockdown. We kept procrastinating, which meant it had to be a lockdown that should have been 8 or 9 weeks or longer, but it was 6 weeks, because then we decided to open up at Christmas. And the government wanted to open up at Christmas at 100 cases a day, which was too much to manage in a suppression strategy. But we opened up at 200 to 400 cases a day. And the result of that was disastrous. And so here we are now in a very long lockdown in 2021 without having a clear exit strategy still. So suppression has failed here. Now, to be fair, there isn't a country on earth that I'm aware of that has had a successful suppression strategy, the middle strategy. Because to suppress a fire while it's happening and still keep everyone working in the building, I mean, that requires a huge degree of finesse and a huge degree of rapid response. And we need to think about the virus as a fire because it multiplies as much as a fire. So living with the fire is not a good strategy in concept. And it's been borne out by the evidence that it's also not a good strategy in practice. It certainly has not worked in Ireland. So we were hoping that this strategy would have been adapted by now, or we'd have altered course. But people want to wait for a vaccine. Now, the problem is a vaccine on its own is not going to solve everything.
Okay, well, Tomas, if you know that, surely other people and experts know this too. So surely we're at a point where we realise now what needs to be done. What is the delay in turning around and saying, you know what, this isn't working, let's change tack?
I think there are a lot of political and cultural reasons why TAC hasn't been changed. To be fair, most of Europe has got this wrong. I think all of the countries that were very successful, it's not because they were isolated places like New Zealand. All of the countries that got this successful got it successful because they did the same things correctly in different ways. Small countries, large countries, democracies, authoritarian states, countries with huge land borders and internal land borders, and islands. And the only thing that they all have in common, really, is that they all made a choice.
Alongside Israel and a small number of Pacific islands who have effectively closed their borders, this decision will mean New Zealand will have the widest ranging and toughest border restrictions of any country in the world.
And they made the choice for different reasons and by different political mechanisms. In the case of New Zealand, it was because the Prime Minister took ownership and took control of the situation early on, and she decided to make a difficult choice. The reality is that if New Zealand and Australia had behaved politically in the way Ireland behaved, they would be in exactly the same situation that we are now. It's not about geography. Now, in Ireland, I think it was a situation that was going to cut one of two ways, in that we were from the beginning in an incredibly advantageous position and an incredibly vulnerable position. And that's what made us different to most of our European counterparts. So we were in a very advantageous position on account of the fact that we were an island with a sparse population, with a huge degree of social cohesion. We can move very rapidly. But we also have a very underperforming healthcare service. And we're more vulnerable in that respect than many European states. I'd also say we're much more social, and our own social habits probably make us a little bit more vulnerable than a lot of other European societies too. So the issue here is not, can you get your head around it? That's part of it. It's also about, can you look at it and admit that it's going to happen? So what happened really had many resemblances to what was happening in 2007 and 2008 with the financial crisis. So we're wired to think that this is because it's a high impact event, that it's also very unlikely.
So is what you're saying here, Tomas, in a very nice diplomatic way, it has to be said, that we were in denial? Are we still in denial?
We were in denial. We are still in denial as a country. I don't think the population is in denial anymore. I don't think the population as a whole was in denial before Christmas. I think most of us were in denial in and around March, or we were confused. I mean, there was a lot of fog back then, and there were opportunities for us. But I remember I was sitting in this coffee shop at Grand Canal Dock in Dublin, where I just started doing some back of the envelope calculations on my phone about what the exposure was to the Irish population if this virus arrived in an uncontrolled way. And I kept checking myself over that hour multiple times because I just couldn't believe that it could be that bad. But of course, it could be that bad. And then I panicked because I could immediately see how this was going to play out in Ireland over the next few months, based on Irish politics, based on the Irish scientific and medical community, based on how we were going to respond to this. It was perfectly clear to me then that if we didn't do something fast and soon, then things were going to go very bad. And I mean, it seemed to me that it was obvious that the decision-making structures we had in place just were not going to make the optimal decisions for what we needed to do, that we had advantages, we could take control of this, but that we needed to move really quickly.
Back-to-back Gold Cups, album photo, the 8th multiple winner of the Cheltenham Gold Cup.
And we didn't stop flights from Cheltenham, we didn't stop flights from Northern Italy, we didn't close the schools soon enough.
It is important that we remain calm, react proportionately and proceed with business as normal, while at the same time adhering to public health guidelines. As of now, the St Patrick's Day festival is going ahead as planned. This could change if the situation escalates.
We were arguing over cancelling St Patrick's Day. That, all these things were happening at that time. And then eventually Though our first lockdown, the death toll was quite significant on account of the nursing homes. It could have been much worse. And throughout that first lockdown, I was concerned that the main way we could control this was testing strategies. So Paul Moyna, who's a professor of immunology at Maynooth, who's been in the media quite a bit, he lobbied NEFIT to set up a testing task force because he could see from a very early on standpoint, he's an excellent immunologist, that we needed a testing task force to do mass testing in Ireland, that mass testing was going to be our way of controlling this. And this was before, test, trace, and isolate was in the mantra of public conversation. And so he set up this group that was attached to the research advisory group, that was attached to the expert advisory group of NEFIT, our National Public Health and Emergency Team. And he asked me to join it. And the committee, in about a week in March, we produced a white paper, cooperatively produced a white paper that we submitted to NEFIT as a way of providing guidance for how we would set up a national testing strategy. And we were dismissed without feedback and disbanded about a week later. As I understand it, it was because we were raising solutions to problems that NEFIT hadn't raised and that the Department of the Taoiseach hadn't raised.
And what were those solutions, Tomas? Because in terms of, I know you've been so strong in your opinions and so outspoken on the need for testing and how we compare to other countries. But it's curious, isn't it, that we actually did 3 times the amount of testing as South Korea, but they were faster. And I know I remember at one point I read somewhere that you had said, we need 100 times the amount of testing per case. So if we have 200 cases a day, we need 20,000 tests a day.
Exactly.
Now we're now up to 22,000 tests a day, and that curve is no more flattening.
Right. No,
so how has testing gone wrong?
Well, one thing that we did do right was we built up the testing capacity. That did happen. Didn't happen quickly enough. And unfortunately, it was wound down over summer. But we knew that back in March, we knew we needed that type of testing capacity because we knew there was no way of suppressing the virus if we didn't have that. And this was before I thought that elimination would be possible for Ireland. We also gave recommendations for antibody testing, which is probably less important in retrospect. And I'm sure that if our recommendations at the time had been taken on board, that it would have led to a more effective testing situation. Because it's not just about capacity. See, it's also about speed. You're quite right that South Korea work with essentially a quarter of our testing capacity if you normalize for population. But they're really fast and they deal with very low case numbers. So if you have low case numbers on a daily basis and you're super fast about doing it, then you can suppress transmission. They still have a high testing capacity, but it doesn't need to be as high as ours. The crucial thing is speed because people are spreading the virus pre-symptomatically. Anyone who's infected never has symptoms until about 4 or 5 days after infection, but they're spreading the virus from 2 or 3 days after infection. So everybody is a silent spreader of the virus before they have symptoms. And you've got to identify those people and isolate them. And that's what speed is all about. If you don't have speed, you're not going to get there. And through April and May, the speed was taking from weeks at one point, so it just wasn't working for that purpose. So that was a major part of it. But since then, have we improved in that? We have the capacity. The speed is still not ideal. I should say the testing itself is fast. The testing being done by the medical scientists who are working tirelessly in the lab, that's being done quickly. But it's the whole infrastructure around the process. You can't have people ringing a phone call to get a call back, to get another call back, to get an appointment, to go in to get swabbed, and then that goes in to be tested. You need to have test centers. You just drive in and you get swabbed and you get your test result within a day. And then people are contact traced. That's what happens in South Korea. There's no reason why we can't do that here.
Well, is there no reason? Because I'd like to draw you out on that, Tomas, because some people listening might be thinking, oh, this is just a case of have deeper pockets or reach further into them. But we actually spent around the same as countries like South Korea. We're not too far off New Zealand. So it's not a money issue.
No,
is it an organizational issue?
Yes, it's an organizational issue. It's also a cultural issue. So we were throwing money at this from early March. There was eye-watering amounts of money being spent. And what bothered me more about the fact that our recommendations were dismissed. And this is all public record. The fact that it was dismissed was I thought, very disturbing. And from an early point in the pandemic, the government was not taking on board the assets of academia and also of the private sector. I mean, the task force that I was on at the time, it didn't just have academics on it. It had people from our biotech and pharma sector on it. And they were all altruistically getting involved because we wanted to do something to reduce the damage that was going to happen to Ireland at the time. But that didn't sit well, it seems to me, with the structures that were responsible for managing the situation. But the National Public Health and Emergency Team, I wouldn't consider it to be an expert group, in the sense that what I would call an expert group is a group that, first of all, has independence, because you're not providing advice if you don't have freedom and independence to say what you think. And secondly, it doesn't have a very diverse range of scientific expertise. It's not independent because most of NPHET are directly employed by the HSE and the Department of Health. And they were there in those roles before the pandemic, and they'll be there in those roles after the pandemic, and they're all aware of that. Furthermore, they're not really active researchers. Most of them are not really scientists or medical doctors in civil service roles. Of course, NPHET has a expert advisory group, but I don't consider it, and I'm being frank here, I don't consider the expert advisory group to NPHET an expert advisory group. It's chaired by Dr. Killian de Gascon. He runs the National Virus Laboratory, obviously plays a very central role, a very important role in how we manage the pandemic. But pretty much everyone on this expert advisory group are medical consultants from hospital environments. Only one or two of them are what one would consider to be very active research scientists. So we're missing a whole range of scientific expertise that should be feeding into NPHET. This has been observed by Professor Garrett Fitzgerald at the University of Pennsylvania, who's one of Ireland's most eminent scientists. He wrote a very incisive op-ed in the Irish Times saying that NPHET should be drawing on the most high-performing scientists in Ireland and in Ireland's diaspora. And why are we not doing this? Why are we not taking the scientific advice that's out there more seriously?
And why are we not?
I don't know if I know the right answer to that question. The problems of it were very serious in the first wave because it wasn't really a problem in the second and third wave. If you imagine the first wave in Ireland, there was a lot of mistakes made. And some of those mistakes were mistakes of judgment about, letting people into nursing homes or not. And people will examine those after the pandemic. But there were also mistakes of scientific communication. Face masks was a big part of this. And NPHET were very reluctant to tell us to be wearing face masks for a very long time. Now, I personally thought this was insane because this was a respiratory infection that was related to SARS-CoV-1. And we had been told that face masks were either unnecessary or may do more damage than not wearing them because touching them may spread the virus more, even though there was no evidence for this. Now, we had a shortage of personal protective equipment. That was a problem. But the fact that we were short on PPE and that PPE should be prioritized for healthcare workers, which is a reasonable judgment, does not mean that we shouldn't be communicating to the public that face masks were obviously a good precaution to make. In Asia, they were wearing face masks from the beginning. It was obviously a sensible judgment to do. And we had scientists in Ireland tell the public why we have to be suspicious of face masks until the evidence shows that they prevent transmission of SARS-CoV-2. Now, this was asinine. There's just no other way of describing it. There was no evidence for that assumption. In a sense, it was misplaced skepticism. A skepticism where, all things being equal, we're going to have skepticism towards a sensible precaution because it's inconvenient for us. Then we're going to have skepticism for whether we're at risk of not blocking airborne or droplet transmission of a virus that we don't know enough about yet.
Let's come back to NPHET there for a minute, Tomás. You're making some valid points that do need exploring, the lack of peer-to-peer conversations among scientists, etc. But from NEFIT's point of view, how responsible would it have been to have conversations on things like mask wearing playing out on a public stage?
I think that I don't know what really happened at those NEFIT meetings because minutes weren't properly taken in any respect. The problem is that it's not a problem. It's we have a really scientifically informed population, and we have a lot of scientists and science communicators and science journalists. And after all of that, you cannot have an organization like NEFIT decide that they're going to interpret the evidence within Ireland differently. You have to acknowledge what the public knows. And with respect to face masks, the evidence was very clear in early April that they were effective in blocking transmission. And NEFIT were actually saying, well, we don't want to recommend them because we don't know if it blocks asymptomatic transmission. All this sort of nonsense. That I took a huge degree of issue with. But I have to say, that we have to remember this was all under battlefield conditions. Since then, since the first wave, I think NEFIT and the Independent Scientific Advocacy Group have been largely on the same page because what they were doing was assessing the situation, communicating caution to the public, modeling where we would end up going, where the pandemic was progressing in Ireland, and calling for the emergency measure of lockdown whenever is necessary. And that was all fine, but they weren't coming up with strategy. And it was very clear that they don't do strategy because they would have come up with one at some point, a long-term strategy between May and December, if that's what their function was, but they never offered one. And it's because strategy is really the government's domain. NEFIT can help to advise, NEFIT can help to implement also, because a large portion of NEFIT is connected with the HSE, of course.
Okay, let's dig into that there for a second. We've seen that there are times when NEFIT and the government are on the same page, times when there's a bit of friction. You said earlier there were times when both failed to draw on Irish expertise, both at home and abroad among the diaspora. So what's going on there? Are NEFIT too politically focused, Tomas, rather than purely science focused? Is that what you're saying?
I think NEFIT in the second and third wave did an excellent job, and we had complete agreement with them. The government were the ones who detached from them. Unfortunately, NEFIT have taken the perspective that we shouldn't go for a zero COVID policy, and I guess we can talk about that in a minute. But to answer your question directly, why is it that NEFIT have not been taking on wider scientific advice? Why are they not been taking on a strategic perspective? We're hearing noises now from government that they would like for them to have taken a more strategic perspective. I suppose it's that you have a lot of people who were in these roles before the pandemic. And in many respects, NEFIT is a pre-pandemic organization. And I don't know, I really don't like criticizing people who find themselves in very difficult positions that they didn't anticipate. But I suspect that the day-to-day manner of public health in a country like Ireland in 2019 was very different than it is in 2020. And I think that you need to reinvent things when you enter this extreme emergency situation. But I don't think that our medical doctors or, of course, our nurses are compensated enough for their efforts. Furthermore, I think that our hospital system is incredibly difficult to work in. Our healthcare system is very demoralizing for all of the people working in it. And I think this makes a lot of medical professionals very frustrated. And that's why a lot of them emigrate. But it does seem to me that a lot of the more ambitious medical doctors become very political. It does seem to me that, and I'm not a medical doctor, so I'm just looking at this from the outside, but it does look like it is a very political, locally kind of political body of people. And so when you see the people who are on top in medicine in Ireland, it does seem that we're selecting for the people who are very, very good at politics. And that's fine. I mean, when you're managing a hospital, when you're managing an organization, a person needs to be good at that. But that doesn't necessarily mean that you're selecting for the kind of person who is going to be the person to respond under a pandemic situation. And science is very different. Science is a different beast entirely.
Okay, so let's pare this down to one sentence then. For a global pandemic, Moss, do we have the wrong people in charge for the wrong reasons?
Yes. I think that, and I really echo Professor Garrett Fitzgerald's comments here, which is that you should be selecting people based first on domain expertise in this particular area. So that means Ireland's top epidemiologists, public health experts, immunologists, molecular biologists for testing strategies, and also public health physicians are absolutely central to the process, and infectious disease specialists, and certainly physicists and environmental people, because we've really dropped the ball on understanding ventilation in this country, and that's a major component of it. Then you need to identify the people who have the best international reputations in these topics in Ireland and in the Irish diaspora. And if you can't find the people in either group, then you source the expertise elsewhere. When you are in this kind of situation, you kind of want people like Luke O'Neill. I'm not saying Luke O'Neill, but I'm saying people like Luke O'Neill at the forefront, not just occasionally giving a call to a political party or occasionally chatting to NEFIT or appearing in television studios. You want them running the organization.
Hang on, let me pick you up on that there, Tomas. So you've said we have the wrong people in charge. So who are the right people? Is it Tony Holohan, Luke O'Neill, someone else entirely?
Tony Holohan is the right man to be Chief Medical Officer because he was a proven Chief Medical Officer since the beginning, since before this pandemic. I have absolutely no question of that. But the Chief Medical Officer perhaps should not be in charge of the situation. I think that the government should have set up, from an administrative perspective, under an organization under the Strategic Emergency Planning Framework. You know what we did when there was a hurricane a couple of years ago? It means one government department takes over and uses all government departments in a holistic way, and it's a much more all of society approach. For some reason, the Fine Gael led government at the time decided not to do that. I don't know why, but they didn't want to take responsibility for that, so they delegated this to NEFIT from the beginning. Forgetting about scientific or medical expertise, that was a politically inappropriate thing to do from day one. And as a result of that, NEFIT became the kind of thing it is today by the prominence it took in the first wave. And of course, if the government want to challenge NEFIT, then they risk their own exposure for when they get it wrong. And that's kind of grew from there. So I don't think
Let me just clarify. Sorry, go ahead there, Tomas. Finish your point.
I was just going to say, I think that Tony Holohan is an appropriate Chief Medical Officer, but I think the Chief Scientific Officer, the Chief Scientific Advisor, who is Professor Mark Ferguson, he should have been at the top table in an equal position. So at the beginning, he was assigned to a research advisory group that advised the expert advisory group that was under Cillian de Gascon. Now, that without any disrespect to Dr. Cillian de Gascon, that was rank. Professor Mark Ferguson is the number one scientist in the government. He is the chief scientific advisor, and he was placed on a subsidiary committee. That changed recently. Now he's been placed on NEFIT itself, but he still shouldn't be a member of NEFIT. He should have his own scientific advisory council, and he should be equal to Tony Holohan. And that's always been very strange to me. And there are other people on NEFIT who've been co-opted recently, who are very established medics in Ireland, and that were not from the HSE or the Department of Health, but it has to be said, have never criticized a single thing of the government's response throughout the pandemic.
And why do you think that is? Because it's hardly that they just don't disagree with anything. So what do you think that comes down to?
Well, I think they're there precisely because they haven't criticized a single thing about the government's response to the pandemic. But this is the problem with top doctors in Ireland being very political, in that they don't want to say something that criticizes the government. And I think that's a problem. So I think that we needed a scientific council, we needed a medical group, which was NEFIT. We needed a testing task force early on. We didn't have that. We needed a vaccine task force, obviously, in place much earlier. And we needed the government to not hide behind making difficult decisions, but to actually produce a strategy that would have seen us through the pandemic. And that didn't really happen. And what was very frustrating was that people from the private sector, from pharma, from academia, who wanted to make positive contributions, who wanted to help, were not listened to, were dismissed. And that was, I thought, very unfortunate, because we did have the human resources, and as you pointed out, we had the financial resources for having a more effective response.
Okay, who are you talking about there now in terms of dismissal? Who was not listened to, who should have been? And when public safety is at risk, isn't there a fine line between providing airtime to people who disagree with government guidance and people who maybe inch toward the more radicalist denial side of things, anti-vaxxers, anti-maskers? Where is the line there?
So when I say that I think people weren't listened to, I don't mean the people with denialist views, because people with denialist views should not, unfortunately, be listened to in a serious way by government. But I think that the academics in our community from the beginning, people like Professor Sam McConkey, who saw this coming very early on. He's an infectious disease specialist, and he tried to communicate with government very, very early on. People like Professor Anthony Staines, people like Professor Jerry Killeen, people like Professor Patricia Kearney, to a large extent, people like Professor Luke O'Neill also. I mean, immunology isn't directly relevant to how you manage a pandemic. Neither is neuroscience, of course, which is what I do. But a lot of people weighed in with providing useful information and perspective whenever they could, most of which had proper domain expertise in those areas. And they don't seem to have been listened to. The attitude has been, well, we've got this. No, thank you very much. And we're going to continue with doing it the way we're doing it.
Okay, that is a perfect place for me to wrap it up, Tomas. But I just want to ask you your final thought in 30 seconds or less, 3 sentences. What has Ireland gotten right? What did we get wrong? And what is the single most important thing to change from here?
Ireland has... God, okay. What have we got? 30,
Take your time, by the way.
30-second answers are the most difficult ones. What Ireland has gotten right is, I think that the citizens have shown a huge degree of community, and people have really done everything they can to get this under control and to support each other in this period. And I think that, broadly speaking, we managed the first lockdown very well. What we've gotten wrong is we've been unwilling to adapt ourselves to changing environments. We've been unable to make uncomfortable decisions. We've been unable to admit that we were wrong as a country in how we've been doing things. And nobody wants to offend anyone. I mean, in one sense here, we're so talkative, we're so frank and so honest. And, you know, in one way, Irish people can say anything to one another. We really do have a different way of communicating that you can't find, I think, almost anywhere else on earth. So when some of my American colleagues chime in on conversations on the pandemic here, they say, you know, they're scientists, they love to talk. But when they're in Ireland, they feel like they're marathon runners in Nigeria. So we have a great way of communication, but at the same time, we just don't want to offend anyone. And we have a certain kind of politeness that prevents us from criticizing any kind of power structure in the country. And that's a problem. And I think that's the core of our Achilles heel in the pandemic. We had the ultimate advantage for keeping the virus out. It's why we had the lowest cases in Europe after the first lockdown. We had an island that was doing the work for us. But because of our politics, we squandered that. And I think that was our major failing.
Well, some stark food for thought there from Tomas Ryan, Associate Professor in the School of Biochemistry and Immunology at Trinity College Dublin, who you just heard sharing his views on Ireland's COVID response, what we got right, wrong, and what could have been done better. That's it for this episode of Diagnosing Ireland, a podcast where we dig into how things work in Irish healthcare. If you want to be part of the conversation around Ireland's COVID-19 response, or anything else for that matter, you'll find us over on Twitter at Diagnosing Ireland. Thanks for listening, and until next time, bye-bye.